CAR T cells, as we know very well now, are important cellular therapeutic method. And just to give one line on CAR T, we take the patient's lymphocyte, transduced with a construct that on the surface puts an antibody-like molecule for BCMA and has T cell stimulatory components inside it. This was a part of the study where we treated 43 patients with myeloma, very advanced disease, with BCMA targeting CAR T cells. And in the main presentation, we report that there is a very high response rate. In the expansion cohort, response rates were 95%. What this poster is describing is that of 16 of those patients were analyzed for minimal residual disease by sequencing-based method. And we report that all 16 patients achieved MRD negativity, which is unbelievably high and interesting number. The important aspect further was that the MRD negativity was achieved very early on, within 1 month's time, even when the protein responses were not observed. So out of first 16 patients who were MRD negative, only 5 of them were CR, the rest were not CR. Some had not even achieved a PR. Over 3 months, 11 of those patients became CR, 5 were VGPR or PR, suggesting that we see MRD negativity first and the traditional responses happen a little bit later, so there was deepening of response. And so there are a number of messages from this. So one is that CAR T cells can achieve really deep response, 10 to minus 5 or in some cases 10 to minus 6 negative MRD status, which is number one. Number two, the CAR T cell have quick response, so we see MRD negativity first, the traditional responses come later. And something to keep in mind or learn from this study is also that we need not wait for CR to be established before we measure MRD. We can sometimes measure early and get the sense of the deeper response.